Hello everyone, this is Dr. Huma Ibrar. I wish you all a good day. This channel is all about international license exam material and guidance. So if you still haven't subscribed this channel, kindly subscribe this channel and don't forget to click the bell icon. So let's start today's topic, recent Saudi license exam MCQs. A 26-year-old athlete twists a knee during a practice session. During the assessment, the physiotherapist performed Lashman test to check the stability of which of the following? Option A, anterior cruciate ligament. Option B, lateral collateral ligament. Option C, medial collateral ligament. Option D, posterior cruciate ligament. And the right option is anterior cruciate ligament. You can take a screenshot of it. What is the name of PNF technique that involves voluntary relaxation followed by passive or active assistive and mildly resisted movement of agonist pattern? Option A, slow reversed hold, rhythmic initiation, repeated contraction, and rhythmic stabilization. The correct option is B. A therapist is treating a patient with strain at one of the deep muscles and wants to reduce pain. Which of the following is most appropriate form of ultrasound that the therapist should use? Option A, pulsed 1. Option B, pulsed 3. Option C, pulsed 5. Option D, pulsed non-pulsed 1. The correct option is option A. Which of the following nerve injuries is a condition in which degeneration of the axon takes place but the sheath of the nerve remains intact? Option A, neuropathy. Option B, neuropraxia. Option C, axontomesis. Option D, neurotmesis. The correct option is option C. A 51-year-old man comes to physical therapy clinic for the assessment of right hip pain, lateral side, that started 2 weeks ago. Pain worsens when the physical therapist tests a muscle that abducts, flexes, internally rotates the hip. Which of the following muscle is the most likely cause of this pain? Option A, iliopsoas. Option B, psoas minor. Option C, psoas major. And option D is tensor fasciae lata. Correct option is D. A 6-month-old baby boy is referred by a neurosurgeon for management. He has an adducted shoulder with a flaccid and internally rotated arm and pronated forearm. The boy's mother has gestational diabetes and difficult labor. Which of the following is the most likely brachial plexus injury? Erb's palsy, Klumpke's palsy, Horner's syndrome, or brachial plexus syndrome? The correct option is A, Erb's palsy. Which of the following muscle is responsible for wrist flexion and abduction? Flexor carpi ulnaris, flexor carpi radialis, flexor digitorum profundus, flexor digitorum superficialis. The correct option is flexor carpi radialis, option B. A 28-year-old man presents to the clinic a pain in his right hip before 1 month ago. The physical therapist applies a measurement of the ground reaction force of the hip joint. Where does the ground reaction force pass at heel strike during normal gait? So the correct option for it is option C, anterior. A 28-year-old man comes to the clinic with the weakness in left elbow muscle. The physical therapist decides to start the treatment plan by strengthening exercise of the elbow muscles and asks the patient to carry weight in hand and hold it without any movement in the elbow joint. What is the type of contraction at the elbow flexion muscles? Isometric, eccentric, isokinetic, concentric. Option A is the correct answer. There were questions from pediatrics: age in which baby recognizes, age in which baby hop, age for stair climbing. Questions from axis: internal and external rotation in which plane, Erb's palsy, torticollis, and sternocleidomastoid positioning. 5 to 6 questions from cardio, nerve injury, neuropraxia, mororeflex, burn percentage, Dupuytren contracture and gluteus weakness. For more Prometric exam material, kindly mail me at hik_28 at the rate of hotmail.com. Thank you for watching this video.